Hello, I am Dr. Scott MacAdam, and today we're going to give you a great, just basic understanding about chiropractic. Chiropractic has been around and established in the United States as an official health entity since the late 1800s. The philosophy of how we look at the spine has been around for thousands of years. Even Hippocrates, the father of medicine, talked about look well to the spine, for all disease and ailments will come from there. But I still, after practicing for 27 years, will still get patients who come up to me who find I'm a chiropractor and ask me, what do you do? What is a chiropractor? There's still some miseducation and misunderstanding about what we do as a profession. So my hope is in the next few minutes, we're going to just give you a good basic understanding about what do we do as chiropractors. Well, it all begins and starts and begins with how the function of the body works together as one piece. So no matter what joint we're talking about, all joints should have normal fluidity, normal movement to them. With the spine, we're specifically concerned about because your entire nervous system comes out from these vertebrae. It all starts from the brain, and the brain sends every impulse to every single organ in your spine out through these vertebrae. So doesn't it seem important that we want to make sure our spine is totally healthy to the best of our ability and in alignment so there's no pressure on a nerve that could affect a specific organ? So for example, if we had a nerve, let's say this nerve right here controlled your heart. If I came along with a scalpel and I was able to just cut that nerve, what happens to the heart? Probably going to stop because you get zero impulses going to the heart. The only way the heart knows how to beat is because the brain's telling it what to do. But what if I come along and I just create a little pressure on that nerve, almost like stepping on a garden hose, and I decrease the amount of impulses coming out or decrease the amount of water coming out of the garden hose to a plant, and we do that for enough years, is that heart going to be healthier or sicker? Well, good chance it's probably going to be sicker because it's not getting the proper nerve supply from the brain to the heart. What does that look like? Well, the heart has to work harder. When it works harder, we call that high blood pressure. And many other things can happen. And that's just talking about that one specific organ. So now apply that philosophy and that principle to any other organ in your body, and things can go south. So we are very, very concerned about making sure every one of your vertebrae in your spine is in alignment so that we remove nerve interference to allow your body to express itself and function at the highest level and remove a lot of symptoms like numbness and tingling, digestion problems, breathing problems, radiating pain down your arms and legs. All those will come because of compressed nerves because of spinal misalignments. Now, does that mean every single one of those issues, every one of those problems is because of your back? Absolutely not. But so many are. And the people we're able to help, that I'm able to help, is because we were able to find the specific source of the problem and correct it by moving that vertebra back in its normal alignment, increasing the integrity of it, the alignment, and reducing nerve interference. And the body does the rest. The body does the healing. I don't heal anything. I'm more of a mechanic. My job is to fix the alignment and let your body do the part of healing itself. So that how it relates to the nervous system. Now let's take this on how it affects the joint itself over the years. If your car was out of alignment, you hit a curb, knocked it out of alignment, and you kind of have ideas because it was pulling a little bit, but you did nothing to the alignment, what would eventually happen? Your tires are going to wear out. What happens when they wear out a lot? They blow out, and now you're stuck on the side of the road. But why does that happen? Because of friction. Your tires are designed to be in alignment to get the most life out of them. So there's least friction as you're going down the road. Well, your body is no different. Every joint, whether it's your knees, your ankles, to your spine, is designed to function in a smooth, fluid way. We have fluid between each joint. They're aligned in a certain way, so there's least friction. Well, when something goes out of alignment because we fall down, we do certain sports, we sit all day, so many different things will cause stress in our body and our joints, they can go out of alignment, and that now starts producing friction. Now, right away, you're not going to feel that. That can go on for years, like a cavity. You can have a cavity for 3 or 4 years. You feel nothing in your tooth until one day you wake up, drink some water, and there's that toothache. Well, did it start that day? Of course not. It started years before that, and that's why now you're getting a root canal, because you never went to the dentist to get your teeth looked at, right? He could have prevented that a long time ago. That's what we do as chiropractors. We can find small misalignments and correct them long before they cause damage to the joints. So if you look at a normal vertebra, this is what it looks like. Nice, healthy looking discs, big spacing between the vertebra. That's normal. And as long as your spine stays in alignment, it's pretty much going to stay that way. This whole thing about, well, I'm 80 years old, of course my spine's going to look like that. Not true. It happens because of what you did earlier in life, because of the football injuries, because of these injuries, the slips and falls. I get 30-year-olds coming here, 20-year-olds who are getting surgery on their lower back because of damage to their discs. And I have 80-year-olds whose spines look like they're 20 years old because of just the choices they make and maybe the luck they had with not having bad accidents. And the spines look like this. So certainly, are you going to see more arthritis in an older person? Absolutely, because this stuff is long-term wear and tear. So of course you're going to see it more in that demographic. But it doesn't have to be that way. So as time goes on, then they can start looking like that. Like tires in the car wearing out. They just wear out. And you get bone spurs and the discs start to decay. And they start wearing out. Then people start getting bulging discs where they bulge out here on the side. Okay? And then compressing a nerve. But this takes time. This doesn't happen overnight. And this is the stuff I treat every day in my office as a chiropractor. Through a decompression table that can open up that spine and decompress it. Through the adjustments. We can stop this from getting worse. We can never reverse the damage, but we certainly can help you function with what is left and what you have and get you to have a higher quality of life by working with it. So in a nutshell, that's chiropractic. Working with the nervous system to remove interference, restoring the normal alignment and function of your body and your joints, whether it's your knees, your ankles, your spine, to reduce inflammation, reduce pain, reduce muscle spasms, and improve quality of life so that you're able to do more and function better. It's all about fixing the problem, not just covering the problem. So many people, when they get in these chronic type of pain syndromes, just start turning to the drugs because they don't want to take the time to go after fixing the problem. And so they get dependent on the aspirins and the Tylenols, and that starts causing digestion problems. So now they have to start taking the Prevacet, and it becomes this ongoing thing of medications, and that's what's happening in our society, especially in the United States. Our older populations are getting more and more dependent on pain meds and drugs they don't necessarily need to take. Because there's plenty of other drugs that we probably do have to take for your health. So why not try to eliminate some of the ones maybe you don't have to take by just taking care of your spine, taking care of your body, and which would take care of your health. So I hope that helps give you a better understanding about what we do as chiropractors. If you have any questions, would ever like to reach out to me, please feel free to contact me. If I can ever help you find a chiropractor in your area, I'm happy to do that too if you don't live close enough for where I am at. Thank you so much. Hope that helps. Have a great day.